Okay, we are recording. Good morning, everyone. So my name is Maggie Dixon. I'm the HVCI Development Coordinator and Jen's Policy Assistant with Prevent Child Abuse New York. We are so excited to welcome you to the first webinar in our 2020 Home Visiting Coordination Initiative webinar relaunch. So today we are joined by Dr. Liz Isaacson. She's the Executive Director for Docs for Tots, and Lori Black, Director at the Early Childhood Alliance. They are going to be giving us a presentation on Help Me Grow. Just a few housekeeping items before we get started. Jen and I will be monitoring the chat during the presentation, so please drop any questions you have or comments in the chat box, and we will answer questions toward the end of the presentation, but we will be looking at the chat box the entire time. Also, after the webinar, you will be receiving a follow-up email with a link to a survey that we would so appreciate if you fill out to give us feedback, as well as a copy of the slides and a recording. The recording will also be available on our website, www.nyshomevisitcord.com, which is continually being updated as we relaunch this next round of HVCI. So I'd like to introduce Jen, Director of Policy and Advocacy and Director of Home Visiting Coordination Initiative.
Thank you so much, Maggie, and thank you all. We've got a great, I'm seeing 46 attendees, which is great attendance for what's a rainy Friday morning in Albany. As Maggie said, the Home Visiting Coordination Initiative is relaunching its webinar series. This is our first in a while, and we're so excited to be joined by Help Me Grow. Help Me Grow is one of those models that if you're not familiar with it, you'll be bowled over by how successful it's been and what a great idea it is. We've been thinking at Prevent Child Abuse New York and at the Home Visiting Coordination Initiative for a while about how to really scale up Help Me Grow, because it certainly seems like a way to better coordinate services across regions. And I'll explain it really briefly, and of course our speakers will get into much more detail about this, but the Help Me Grow model is really kind of cogs in a wheel, if you will. So there's a centralized access point, there's data collection and analysis, there is family and community outreach, and there's child health provider outreach. And these are all connected with a thread of continuous system improvement. And when we embarked on our regional work last year, we heard about Help Me Grow in a couple of different places. There are programs on Long Island, in Onondaga County, and in Western New York. And so you're going to hear today from Dr. Liz Isaacson on Long Island and Lori Black in Onondaga County. And we hope to have questions and answers and a little bit of a discussion the last 15 minutes or so of this webinar to get your good thoughts about interest in Help Me Grow, and possibly like I said to begin with, kind of scaling this up. What good ideas could we come up with to make this a statewide approach? But right now we want to hear what's happening on the ground. So I'm going to turn it over to Liz and Lori. Again, thank you guys for joining us.
Great. Well, thank you so much for having us. Lori, I am going to pull up the slides just now. Give me a second. Can everyone see the screen?
Yes.
Okay, great. There we go. So that's us. You'll see that there's actually 4 communities. Greater Rochester area, Long Island, Onondaga, and Western New York, and that is what the website we have looks like. And we've already gotten a nice introduction from Jen and Maggie, but I'll just say a little bit about Docs for Tots. It's an organization I run with a staff of 6, and quite frankly, they run it and I just talk. And they're fabulous, and we do a lot of our work on Long Island, really thinking about early childhood systems. We come at it from a medical approach. I'm a pediatrician by training, but we really want to better integrate all the services for kids to create a quilt that can help support families. Lori?
Great, and good morning. My name is Lori Black. I am the director of the Early Childhood Alliance here in Onondaga County, and that is basically a cross-sector coalition of partners focused on our early childhood system and strengthening it so that all children in Onondaga County are healthy, thriving, and ready to succeed in school. And Help Me Grow is a strategy of the many strategies that we advance as a coalition of partners. And I'm really excited to be here. I'm going to go to the next slide, Liz. I get to kind of set the stage of why would a community think about becoming a Help Me Grow community? And what we know is that the American Academy of Pediatrics would estimate that about 1 in 4 children are at some kind of risk of some kind of developmental delay in the early years. So anything that hits or affects 25% of your population, you should be having a conversation about. And as you look at the early childhood system research and literature, they often will encourage communities to have a approach or a strategy to comprehensive developmental screening. Because so many children are at risk, you want to have an intentionality as a community about screening children, and then most importantly, not only screening, but effectively linking families to services. And one of the things that stood out to us as a community when we were exploring what to do about comprehensive developmental screening is that New York State ranks almost the lowest in the country for having parents self-report that they have had a developmental screen in the last year. This is a national survey that collects across the country how families are self-reporting whether or not they had developmental screening. There could be a lot going on in that question, whether or not kids are actually having screens, but parents don't actually know that it is a developmental screen. But in comparison to other states, New York ranks low, and that's a little alarming. And then we all know that developmental screening plays a really important role in connecting children to services. So you don't just screen to screen, but with all those children potentially being at risk, we want a real preventative approach to identifying early, connecting children to resources. And we know that pediatrics, just from the literature and even looking at our own communities, it's inconsistent across the board what screening mechanisms and tools that pediatric practices are using. Similarly, we know Head Starts have a very robust screening process, but not all child care centers do. Not all family child care providers do developmental screening, let alone legally exempt. So there's a lot of gaps. So when a community is thinking about, okay, we want to talk about comprehensive developmental screening, you have to take a landscape look at what's going on. With regard to home visiting, we know different programs use different tools, and some programs don't use tools at all. And so it's important for communities to think about, are we missing kids because we don't have a coordinated approach to developmental screening? Also, we know that children, next slide, that children are surfacing in our schools with some form of developmental delay that was not identified. The system of early childhood, we often laugh in our own community. We call it an early childhood system, but it's anything but a coordinated, effective system. We have to build that. It's a very fragmented system, and families get lost in this system. And so kids might have delays that get identified, but they have trouble connecting to services. So it really Help Me Grow, and we'll learn more about Help Me Grow, but the why behind Help Me Grow is really that kids are not getting the services that they need. They're showing up in schools, and families would benefit if communities could find ways to strengthen that infrastructure of support for children and families and really connect them to services much earlier than we're able to already. Next slide. So, and I love to use the words of Dr. Dworkin because he is the guru of Help Me Grow. And this is a slide or a picture from one of the Help Me Grow forums that we had the opportunity. So that's Liz standing to the left of Dr. Dworkin, and I'm in the pink sweater down below. And we're really his fan club because he really has designed this phenomenal approach to developmental detection and linkages to services. And what I love about his quote there, one of the most attractive characteristics of Help Me Grow is that it's elegant in its simplicity. And I know we apply that to other things, but it really does apply to Help Me Grow. It is about layering on top of your existing infrastructure. We all have communities that have programs and services. Help Me Grow layers on top. It's not a big bureaucracy or big infrastructure, a simple, elegant approach to connecting families in this fragmented system. And so now we're going to learn from Liz a little bit more about the Help Me Grow model.
So hi, everyone. I think that Lori did an amazing job really giving us the background of why this is needed. And, oh, sorry, I wanted to get those things to stop turning, but I can't. Anyways, the most important part of Help Me Grow is that it's not a program. It's really a model. So we're not there to replace any existing programs that might exist in a community. We're there to help them connect to each other because we know that that doesn't happen as much as it should. So there's a centralized access point which families can access. which pediatricians and home visitors and even staff at a food bank can refer families through that centralized access point to get help connecting to basic needs, developmental screening, whatever that family might need. We also have data collection, and this is one of the most powerful things. When a little later on, I'll speak specifically to Long Island. That data allows us to see the gaps. So one of the first things we were doing in Long Island is we collected this data, and the #1 barrier for families that they reported to getting the help they needed is that no one called them back. And when we went back to our community partners and told them this, everyone was like, no, we call everybody back 100% of the time. Well, I know you're lying when you say 100% of the time, because nobody does anything 100% of the time, right? And so it allowed us to take a look inside and say, well, why aren't they getting their phone calls returned? Is it a language issue? Is it not prioritizing that within our own institution? So it really, you know, this data helps us improve services for families. The child health provider outreach is another strong tenet of it. Although Help Me Grow acknowledges that a pediatric office is a great place to do screening, we realize, as Lori so well pointed out, that they don't always happen there and that they're not enough, because what we not only need is the screening, but the attachments. So many times some health providers will screen children, and they'll actually use Help Me Grow to help connect them to the services that are needed within a community. And family and community outreach, I think the best example of this is actually COVID-19. On Long Island, when COVID-19 hit, our calls from families went up by 300%. And they were looking for services that were all basic needs. They were looking for, I'm sure it happened in your communities too that you work in. They were looking for diapers. They were looking for formula. They were looking for benefits. They were looking for all these other things. And so at that time, all the families are finding us by word of mouth. It was one family telling another family, call Help Me Grow, and they'll help you get connected. And then we did the outreach into the community, found out who's open, who's closed, how are their hours changed, what are they planning to come back online, and sort of helped with that coordination, which was happening on multiple different layers, but sometimes the youngest children get overlooked. And we actually had an issue with the food banks in that they said that they had diapers, but the moms with the little kids were waiting out in line with all these single adults for hours, and the kids couldn't wait in that line and anything. So we tried to work with the food banks to change the distribution of diapers away from the other lines that were food. The other thing that happened is some of the food banks were distributing like 10 diapers. 10. You wait in line for 2 hours, you get 10 diapers, right? So we work with them to understand what diaper usage is. And if you're gonna go visit that food bank once a week, you actually need diapers to last a week, and that's gonna vary by the child's age, right? An infant goes through 10 diapers in one day. So it's really cooperation, and communication. And that's the use of Help Me Grow. It's not a program, it's a model of bringing the existing services, helping them understand the needs of young children and their families in a way that doesn't get highlighted usually. This is a beautiful flower. Advancing children's optimal healthy development is at the core of what I believe as a pediatrician. It's also at the core of Help Me Grow. And Help Me Grow is not a medical intervention. It's not an education intervention. It's not a family support intervention. It's literally all of these things. So whether that means that we are finding families help with transportation, we are sometimes referring families to economic opportunity corporations in our thing. So we're also helping the parents, because if you help the parents, you guys are home visitors. I don't need to tell you that. If you help the parent, you help the kid. So really, we're a multi-disciplined vision, but we're not trying to do any of these one services ourselves at Help Me Grow. We're finding where they exist in the community and helping families reach them and helping the existing programs understand the needs of infants and toddlers, which are different than a school-age child, which are different than a teenager, which are different than the elderly. So this is just a big picture of Help Me Grow. There are, at the close of 2019, there were 104 Help Me Grow systems embedded within 31 states across the country and Washington, D.C. The little blue colors there are things that are like up and coming. And I do actually know that not the whole state of Texas, it's like North Texas has theirs up and running now. So there's lots of people doing this around the country. And one of the most wonderful things about that is we try to get together every year, sometimes virtually, and we share and we steal shamelessly. Like if someone else has a good idea, actually the other day I was on a phone call with someone from Utah, Help Me Grow, and she has this amazing idea. I was like, send it to me. I'm stealing that. I want to start it. So every community across the country faces these. Why are we reinventing the wheel all the time? Let's share better. Let's understand better. So this is, I think this is my last slide, right, Lori? Yeah, this is really the theory of change for local implementation of Help Me Grow. And let me just, I'll step back a second. So as you heard, we have 4 locations in New York. Most of the big states do not have statewide Help Me Grows. California has sort of like 31 different counties that have their own Help Me Grows. I don't know if that number is exact, but it's a lot. But a state like Vermont has just one Help Me Grow, right? Because it's a small state, not a big population. So it looks different everywhere you are. But the core components is that if there's a centralized access point for community-based resources and supports that understands young children, then we can expand care coordination capacity and we can connect children better to the appropriate services. If we engage in child health provider and developmental screening, surveillance, and linkage through Help Me Grow, we support child health providers in ensuring early detection of developmental or behavioral concerns so we can get those kids services that they're eligible for. And if we connect families and community service providers to each other, then we create more seamless systems of support for youth, family, and children. So even as we connect families, I'm okay if we introduce 2 different partners to each other, and they used to refer through Help Me Grow, but instead they now know each other so well, they just refer directly. That's not a problem for Help Me Grow. That's a success for Help Me Grow. Because again, we're becoming more efficient and better, because we really want to advance the developmental promotion, early detection, and linkages to services to help support families' development and all of young children. All right. So we're going to talk to you a little bit about Help Me Grow New York, a little more. Do you want me to go to the next slide, Lori?
Yeah, next slide.
Okay.
So I'm going to give you, and this is all on the Help Me Grow New York State website. So all 4 affiliates have jointly produced one Help Me Grow New York website, and just a little timeline, and this timeline's there. Help Me Grow nationally was started by my hero, Dr. Paul Dworkin, in the late 90s. And then he took it from Hartford, Connecticut, and took it statewide in Connecticut. The first replication in his vision was that this would be replicated across the country. The first replication site was Orange County, California in 2005. New York State got introduced or brought into the mix of states that started expanding Help Me Grow across the country in 2011. It was really brought to New York State with the Health Foundation for Western and Central New York's investment in it, and starting with partners in Western New York. And it started out, and it had a couple iterations in Western New York. It started off in one iteration and then rebooted in 2014. So the first phase of it was them getting their feet wet and having some learning experiences with it. But then 2014 to 2017 is when it started to take real hold in Western New York. It started off in Erie and Niagara counties. And then in 2017, they went broader and became an 8-county Help Me Grow. And then not far behind that, Long Island, which it was perfectly aligned with the work that Liz and her team were doing with Docs for Tots. And they were already, I would say they were already kind of running down the path, as opposed to our community that started in 2019, a year later. We had a lot of pre-work to do. We had a lot of bringing people together to really think about Help Me Grow before we could start walking down the path. They were running and we're still trying to catch up to them. So they're light years ahead and they're doing phenomenal work on Long Island. We're building a different model. And one of the beauties of Help Me Grow, and Liz kind of alluded to this, is they always say, you've met one Help Me Grow, you've met one Help Me Grow. The beauty is there is a model and there is a way to implement this model, and National has thought through all the components of the model, but each community evolves their Help Me Grow to the ability that they where their sweet spot is, where their natural tendencies are to do good work. That's where they start. And so we launched in 2019, and then Help Me Grow. Well, Grow Rochester was already in existence, and they were doing some phenomenal work about developmental screening in Rochester. And so now they wear both hats. They're still Grow Rochester, but they're also Help Me Grow. And that's our big, bold team, but we have a big, bold vision that this goes further and meets the, as Liz said, every community has this challenge. Anyone who's in the early childhood space has a challenge around comprehensive developmental screening. As you survey the landscape out there across the country, there aren't many solutions to the problem. Help Me Grow is the wheel that already exists, and I'm not sure why you would try to recreate a different wheel, as opposed to benefiting from all these places across the country that are doing this similar work. I think that's what Liz is referring to, is as we connect with other communities across the country, we learn from them and we bring best practices back here. So next slide. So I just wanted to speak kind of at the high level of how Help Me Grow intersects with home visiting. And so if you're a home visitor and you're thinking, well, how would I benefit from Help Me Grow? A couple ways to think about it is, we all have 211 in New York State, so every community has the ability to call 211. But 211 is a generalist line. What Help Me Grow does is it complements 211 and builds a deep bench of knowledge about the resources and supports for families and children in the early childhood space. So now if you're a Help Me Grow community and you're a home visitor and you call 211, you can get connected to the Help Me Grow individual who has the array of services at their fingertips and understands them. So we have built deep knowledge into the 211 system through our Help Me Grow. And that's helpful to a home visitor because as you go and support families, oftentimes families need help navigating the resources. And now you have a partner in Help Me Grow that can help walk you through what resources exist. They become real experts in the resources, where to go to get those diapers that you need, or where to go to find the formula because it's in high demand. And so that service navigation is an incredibly important role, and it supports home visiting. Also, if you're a home visitor, you may have a family that has concerns about their child's development. And so at that individual level, you may say, well, I can go to the Help Me Grow website. I live in a Help Me Grow community. We can do a free developmental screen online. So as a home visitor, you could walk a family through, or you could print off the screen and work with Help Me Grow to get that family screened. Or, and Liz is going to talk a lot about how she does this on Long Island, you could partner as a home visiting program with Help Me Grow and design a whole screening strategy through Help Me Grow. So not at the individual level, but your whole program, your home visiting program could do screenings through Help Me Grow in partnership with Help Me Grow and make sure that all the children in your program are having developmental screens done at a regular interval. And then we have access to a lot through Help Me Grow. We have access to a lot of developmental promotion materials. We love Learn the Signs Act Early resources. Long Island's Help Me Grow is kind of the state lead for that and implementing that. So you can call Help Me Grow. Our website has tons of resources. We can make these early child development resources available to you as a home visitor to make available to your families. And then last but not least, this fun activity that we have as a Help Me Grow is called Books, Balls, and Blocks. And it's a great way to promote developmental awareness and understanding among families and do developmental screening at events. So if you're a home visiting program, you have Help Me Grow, we would partner with those home visiting programs to design an event for their families so that they deepen their knowledge around child development. Next slide. So this is just a picture of our website. Definitely encourage you to go to it. It was released in 2020, so it's a new website that really incorporates the best of what we have to offer. There's so much there. You could spend hours just kind of going through the resources and seeing what's available to you. And then again, this is the landing page. If a family lives in our communities that have Help Me Grow, they can get access to the child development questionnaires, the ages and stages questionnaires for free. Both the ASQ3 and the ASQ-SE are available to the families in our regions to access through the website. You're on mute.
All right, that has to happen at least once a day, so now it's over with. Thank God it's Friday, right? So thank you, Lori, and I think that's a great overview, and it's going to let me dive into our story here on Long Island. And I think the important, Lori alluded to this a little bit, but Help Me Grow for us, we came to this solution really from a healthcare standpoint. We had been encouraging federally qualified community health centers that serve largely Medicaid families to screen, and we got them all screening. And then what happened is the wheels would fall off the bus between the clinic and the referral to EI or preschool special ed, and the family actually getting it. And the doctors grew very frustrated. They didn't want to screen if the families never got connected, and it was a big problem for us. So we said, well, how do, who out there knows how to connect families to services? And that's how we ended up at Help Me Grow. So we came out of it from that specific problem, but had been working, Dr. Tots had been working with childcare, the childcare resource referral networks, many of the home visiting programs on Long Island. So we already had deep partners already existing. So we actually got, we looked for money in 2016. We spent a whole year planning in 2017, and then we launched in 2018. And really the focus for us has always been systems building. And what we mean by that is making existing services work better together. And Long Island, I don't know if there's any Long Island people out there on the phone today, but it's unique, right? It's about 3 million people on the whole island. You kind of get overshadowed by the big New York City, and it has 125 school districts. So if you're thinking about sending a kid for preschool special ed, there's 125 different application processes to figure out how to get through that. EI is, at least at the county level, it actually is a little smoother, but it's very confusing for families because you can actually live in one town but be zoned to a different school district. It happens all over the state, but it's really bad on Long Island. And the other thing I think that Help Me Grow National does, but was also a key component for us, is that the parent or the caregiver is actually the partner, right? They're just as important as a partner as any of the agencies that we work with. And I think that fits very well with the home visiting viewpoint, right? That it's when we get a referral, no matter what the doctor writes down on the referral, our family resource specialist asks the parent what they want, even if it's different than what the doctor put on the referral. And then we'll help the parent communicate that back why there was a difference of opinion. Gets a little touchy, but it's an important conversation. So the parent and the caregiver is always first. So we have some data that I'm going to share with you. It's a messy slide, but again, we haven't been around for that long. So we took a year of really good data. So we didn't sort of look at the first 6 months because that was sort of figuring out things. But we published this spring that over a 12-month period, nearly 3/4 of the children served by our centralized access point were under the age of 3, meaning 36 months, and 6% of all calls were from expected parents. And I think that this I want to pause on because so many of the home visiting programs deal with infants and toddlers, but many other services do not disproportionately serve very young children. I used to have a conversation with a colleague of mine who has a PhD in child psychology. And we had an argument one day, and she's like, well, that's not early childhood. That's not early childhood. And I was like, well, when you say early childhood, like, tell me what that kid looks like. And she pictured a 4-year-old going off to pre-K. And when someone says early childhood to me, I picture a 6-month-old. Very different. It's all part of the same, but Help Me Grow does skew younger, at least in Long Island. Our centralized access point serves 3 times the percentage of Hispanic and Latino families and 2 times the African American families compared to rest of the Long Island population. So we are serving a disproportionately diverse group of parents. A little bit of that is Long Island is rapidly changing demographically, so young children are more likely to be of color than an older population. But it also means that we're looking for health equity and access to services. Nearly half our families have a non-English primary language, Spanish being the most common, and that's followed by Haitian Creole. And both of our family resource specialists are bilingual. We feel that if you're going to serve families in our particular geographic area, that's just necessary. 50% of our referrals come from healthcare providers, so that's very large. A lot of times these are healthcare providers that are curious about, they're concerned about development, but sometimes it's also basic needs. They know the family needs to be connected to a food bank or to something else, and they don't have the wherewithal in their office to do that. The number one reason for contacting Help Me Grow Long Island is a developmental concern. And the number two reason is a basic need. And we define basic needs as diaper, clothing, housing, but we can't solve housing. If you can, let me know, put it in the chat box. And anything else, you know, that a family needs to take care of their baby. So I'm going to give you a quick success story. So a federally qualified community health center referred a mother and child. So it's the pediatrician that referred by our universal referral form. They faxed it over. Doctors love faxes. The initial referral this physician made was to early intervention when he was concerned about the child's development in 2017. But we got the referral in 2019 because the mom had repeatedly come back to the clinic and they had tried, but they'd never been able to make the connection. And at this point, the child was only eligible for preschool special ed. You know, they're over 36 months. So what our family resource specialist did is the mom spoke only Spanish and she couldn't read or write in any language. The child had increasingly demonstrated the need for special education services, and mom had tried but couldn't understand the process and communication. She had very little family support. We really empowered mom. I know this sounds crazy. We never meet our families. We only talk to them and text them. So one of the things we did is we would text her pictures of all the logos of the different mail she was going to get from the county and from us and from everything else. So then when she saw that logo, then she knew to put that aside and call the family resource specialist and they could read the letter together. We also, at that time, the Early Childhood Direction Center was still up. Now it's something else, it's called FACE. But at that time they were still working, and we actually, don't tell anyone, we ramrodded them. We were like, you have to go to the meetings with the mother. And so they did. They actually accompanied the mom to many of the meetings at the school district. And after 3 months of this kind of back and forth with the school district, the pediatrician's office, everything, received the evaluation and got services. So this mom had tried, right? It wasn't for lack of effort. It was for lack of understanding and lack of a system that was going to help someone that didn't have the empowerment to get through the process. And she still contacts us now sometimes with little things that she needs help understanding. And it's lovely because we know that there's lots of red tape and someone like this is not going to make it through that red tape. So that's kind of a classic example of a normal case that we would see, you know, multiple times a week. Now, our work with home visiting, it really is varied. We have four major home visiting programs on Long Island, and if I'm missing one, I am so sorry, but this was my best bet. Well, we have a very good relationship with Northwell Health Visits with the Family Connects Long Island. That's a universal home visiting model out of Northwell, and they administer the ASQ3 at the end of the service, at the end of their time with their families, and then give the families, because it's a relatively brief intervention, they give the family all the information about Help Me Grow Long Island. So what we provide Northwell Health Visits is that since we have this large ASQ online database, they get their own portal, they get the ASQs for free, and they get to track longitudinally. And also, as the child leaves the program, they're hooking them up with us, and then we're going to be sending them messages on an ongoing basis saying, hey, would you like to take another screen? It's time for another screen. So we're sort of extending their service and giving them a transition. The Nurse Family Partnership is in Nassau County. We have a very good working relationship with them. We do a lot of bilateral referrals in that they will send families to us that need things that they haven't been able to find, especially for basic needs. And then we do a lot of referral back to them when pregnant moms call us. It's difficult because we get calls from all over the island, and as you know, they have very limited zip codes. So we've worked very hard over time to make sure that we're not sending a mom to them that's not going to ever be eligible, because we found out early on that that wasn't nice for mom. So we have a good relationship with that. The other thing is at the end as well, when the babies and the moms graduate after 2 years, they give them our information as a transition if they need help going forward. And the Healthy Families of Suffolk, again, it's a bilateral referral process. And then Parent-Child Home, bilateral referral process, they refer to us and we refer to them. The other issue, the thing that we're doing with Parent-Child Home right now is after COVID, this is another thing about Help Me Grow. We were able to get a large donation to be spent on basic needs. So we are now, with many of our partners, buying huge amounts of diapers through the diaper bank and distributing them all to our partners. Nurse Family Partnership couldn't take any because they were moving offices and they didn't have room to store them. So we're going to order again in a month, and I think they've officially moved and now have a closet. So we're going to make sure that they get diapers this time. So again, we dispersed to 8 different programs. Those 8 different programs never would have gotten the grant to buy diapers, but we got a big grant, and then we've done 8. We're probably going to do another 7 programs, and then hopefully we're going to have a diaper driver too. Okay, that's it for sort of the Help Me Grow Long Island. I'm going to pass it over to Lori, and we got, like, I'd say 10 minutes to finish up, Jen? Okay, I think we're going to be good.
Great.
Yeah, we've got about 20 minutes, so go for it.
All right, so it's always hard to follow Liz because she's so phenomenal, but I'll give it my best. But we really wanted to kind of highlight Onondaga County as well, because we are a very different animal than Docs for Tots as the leadership organization, because this was their wheelhouse and this just aligns with their work. So we wanted to show you as home visitors who are probably like, yeah, but we don't have Help Me Grow in our community. And as part of our messages, we think, Help Me Grow should be more widespread, but that it's a very doable process for you as a community to kind of get in alignment with the initiative and to build momentum and to find a way to make it happen in your community, because we really do believe in this work. We think it's incredibly important. So just big picture, if you're not familiar with Onondaga County, we're in central New York. We like to affectionately call ourselves the heart of New York. And so we're relatively a very manageable community. We have 470,000 residents. I know there are much bigger communities in New York State. And then there are Help Me Grows that are multi-county. Long Island is a multi-county Help Me Grow. Western New York is an 8-county. We're just one small little county doing our work together. We have about 30,000 children birth to 6, or birth through 5, and then we have high concentrations of poverty, as many communities do. And then one of the real galvanizing forces for the Early Childhood Alliance to come together, which Help Me Grow is a strategy of, was our low performance on 3rd grade reading. So in our city, 22% of kids are reading on grade level by 3rd grade. Across our county, it's 40%. That is a really motivating factor to saying we have so much more work to do in our early childhood space to get kids ready for school so that they can be successful in school. Next slide. So just a little bit about our journey in becoming Help Me Grow. The next slide will come in a second, Liz.
Yeah, there we go. Sorry, I something went wrong.
So we launched the Early Childhood Alliance in 2015. And 2016 for us was really about breaking down into committees. And so we had developed a committee called the Comprehensive Developmental Screening Committee, but we didn't call it Help Me Grow because we didn't know getting out of the gate that we were going to become Help Me Grow. We had to have the conversation and bring the partners together. And this is kind of my message to you as a community member who may not have Help Me Grow, is that starts with people who are passionate about this conversation and getting the right people at the table. So we had a committee that met for really 2 years of grappling with what are we doing around developmental screening? Who's doing what? What are the practices of pediatrics? We brought pediatrics to the table, the healthcare profession. We brought cross-sector people together to talk about what's the path forward for Onondaga County. We were fortunate because we were able to connect with both Long Island and Western New York to see what was happening there. So just having the vision of what it could be. And then one of the things we did out of the gate was we sent a team to Help Me Grow National Forum, because you can't go to National Forum and not leave there saying, how are we going to get this in our own community? And we were strategic about bringing our Commissioner of Health with us. Our county has been instrumental to making Help Me Grow a reality. So we have commissioners and frontline workers in our Healthy Families Division, all kind of actively engaged in the conversation. But it would take a lot of conversation. I don't think you can just plop down and say, I think we're going to become Help Me Grow. You have to figure out what is the right home for Help Me Grow? Who's going to be the call line? Who are the people that need to be part of it? What kind of staffing configuration? What's the funding? We had a small grant, and this is the other message I want to convey is it doesn't take a lot of resources to get yourself going with Help Me Grow. We had a 1 FTE plus myself kind of working together, the 1 FTE being dedicated to Help Me Grow as kind of our family resource coordinator or family services coordinator. And then I worked with that family service coordinator to kind of build up the original model. So that was all taking place from 2018. We officially launched in 2019 with that 1 FTE. And then since then, we've been able to make the case to our county to invest in Help Me Grow as a core strategy for our county. And so the county is helping to fund, we have some philanthropy helping to fund 2 positions. Liz, if you go to the next slide, you'll kind of see our organizational infrastructure for Help Me Grow. But for the first year and a half, we were really 1 FTE, and that's Summer Merrick, and she's a phenom in running our program. And so we work closely in partnership, and she has really taken on. But as one person, you can do some of the core components of the model. What we decided in Onondaga County was we weren't going to just start with pediatrics, because that's a heavy lift for anyone other than Docs for Tots. You have to go gracefully into the world of pediatrics and take the time to nurture the deeper understanding. So we started where our sweet spot was. We had 211 that was very interested in working with us. And they were only interested because they called their colleagues in Western New York and they said, Western New York folks said, we love Help Me Grow. So like, if you are in a community that doesn't have Help Me Grow, you might have your 211 contact any of our 211s and they too will kind of sell it because you do need the call line. And that's where we started because we had partnerships. We put in the individual who was going to take the calls to become the deeper bench to 211 and be the navigator to resources. And then the other piece that is pretty easy for communities to do is the community outreach. So our person was not only the family resource special, they were doing community outreach. So tabling at events. One of the things that I've come to understand about Help Me Grow in this process is how it has a lane in a community and we didn't have lots of people going out and doing developmental promotion with families, right? There was a real gap, and there is a real gap in the deepening the awareness and understanding about developmental milestones and the role that families and communities play in advancing developmental milestones. And so that's a really important lane that Help Me Grow can play in a community is the education piece. And that is something that doesn't cost a lot of money. It costs, it's the conversation, it's the promotion, it's the education. We have opportunities to train home visitors on deepening their knowledge. We have opportunities to partner up and to support families. So this is the way our organization looks right now. This is the design. This was our dream. So we went from 1 FTE to now 4 FTEs. This is probably the right mix for us for now in the short run. We're doing the core components with this staffing configuration, but it's not a big heavy lift on the budget side. And I just want to emphasize, you can do it relatively cheaply with 1 FTE to get your feet wet, to get in the door as you continue to kind of think about what's the long-term funding situation and proof of concept to your community. Next slide. So again, what I just emphasized was that where Help Me Grow really meets a need in our community, and I would think maybe across New York State, is in advancing a deeper awareness about child development and taking that to all corners. So whether we're talking about home visiting or childcare or pediatrics or families, all of those core pieces of what we think of as our early childhood system, we all could deepen our awareness of, what's a typical development for a 2-year-old, or what's a typical development for a 4-year-old, and when we're worried, what do we do? And when things are in, say, in ASQ language, in the monitoring zone, right? They're not at risk where they need to be in early intervention or preschool special education, but they're monitoring. How do we support families in preventing that delay from becoming a more advanced delay? There are things that families, by being empowered with knowledge, could be doing at home to kind of prevent further needs for early intervention and preschool special education. And so that's the wheelhouse. That's like the specialty sweet spot of Help Me Grow is communities have gotten relatively good at making referrals to EI and preschool special education. What we need to do more of is on the preventative side, before the delays become more advanced, making sure that families and providers have deep awareness of what kind of activities support child development across the developmental domains. And that's where Help Me Grow can be very helpful in communities in partnership with home visiting, pediatrics, and childcare. Next slide. And the last thing, I made mention of this, but I just wanted to emphasize it. It's really important to have the county at the table from our perspective in New York State. The county is the big player in the early childhood system. Most things flow through the county. And so we were very fortunate as an Early Childhood Alliance, as we were building our bigger, broader coalition of support, to have the county, the Deputy County Executive has been at the table, helped to create the Early Childhood Alliance. The commissioners are engaged in each of our committees. We just had an Early Childhood Alliance Leadership Council meeting this morning. We are deeply invested in strengthening the early childhood system. So if you're starting from more of a square one, you want the county leadership engaged, you would want them at the table. Eventually, you would want to make the case that the way to sustain Help Me Grow is really public funding in the long run, whether we're talking about our New York State partners or our county partners. Public funding is pretty much, but again, I kind of emphasize, it's not a lot of resources to do a better job to coordinate the system, but it must happen, right? You can't get a stronger, more effective early childhood system without better coordination. It is the necessary ingredient to better supporting children and families.
All right, thank you, Lori. This is just our contact information, and I'll hand it back to Jen because I think we can take some questions.
Yeah, thank you guys for a great presentation. Hopefully some food for thought for folks. We do have a couple of questions. The first is, are you currently working with anyone in Broome or Tioga counties? Not yet, okay? And we'll figure out how to make that happen.
I mean, Liz, if you want to flip back to that map of New York State at the very beginning, or any of the ones that show New York State, I mean, it is limited Help Me Grow's reach at the moment, but we ideally will see that map, you know, there, right there. You know, many colleagues that are doing, we will learn together through the.
Yeah, I'm gonna, in that area, I'm going to allow you to talk. There you go. Did you have a question, Sharon?
Unmute. Okay. Hi. Hi. Okay. So thank you, Jen, for giving me the opportunity to talk. I was trying to figure out which Q&A or the chat box to put it into. So thank you. This information was really incredible, and I'm very, very interested in it. And so, Laura, you had touched base on my main question with the funding, and I saw in one of your slides you had like a 1.5 million. What did you start out with in order to launch?
So, and 1.5 million is not Help Me Grow at all. That is a big portion of that is some work we're doing on childcare, which is a big heavy lift in our community. Help Me Grow, you know, when we launched the process without any FTE, right? Like we launched the committees, but that my role helped facilitate that work in our community. But you could designate anyone in your community. You, Sharon, could be the, you know, the person who convenes the committee. Yep. And has the conversation about developmental screening. When we had an FTE, I mean, the budget over years, a 3-year grant from the Health Foundation for Western and Central New York was $180,000. And most of that was pre-planning work. Like we did work with National Help Me Grow Center to do some fidelity assessment, readiness assessment works, just the pre-planning. So if you can imagine an FTE in a community, what you pay a salaried person, say $50,000, $60,000 plus the benefits, you could start Help Me Grow with that kind of small investment plus some obviously supply line. So I just feel like it's not a budget breaker to get started. You can start without any money, and then you can start the process if it's embedded in a natural entity that can help support it. So there does have to be, and I see Liz nodding her head, a backbone organization that this makes sense for to kind of help and support it. You wouldn't want to just say, okay, we have Help Me Grow and we have one person, but there's an organizational support. But I don't think it has to be a lot of resources. Liz, do you want to add to that?
Yeah, I would agree. I can't remember what our budget was for the planning year, but it wasn't much more than $100,000. And that was really for a full-time equivalent to, as I say on Long Island, herd the cat, like sort of get the whole community together and start thinking about this. And we needed a full-time person to do it because there didn't really exist anyone else that was already doing it. And Long Island is so big. Like we were doing a large population all at once. And there was reasons we picked that large population that are just inherent to Long Island. So, and I think the first year we were operating, we started with 2 family resource specialists. Again, we were a little afraid because the overall population was so large. We were afraid if we got 1, we'd be swamped. So we did start with 2, but again, I think the whole budget was $200,000. We were able to leverage a early childhood comprehensive services grant that New York State got, and we were named as a community. So about half of that originally came from that, and then half came from private philanthropy. We have not been as successful as Lori has been in sort of getting that county level involvement, I think because we have had the state funding, but we kind of pieced together our funding now, and 3 years in, we're a little bit bigger of a budget. I think if you do our state and our private funding, we're almost to $500,000 next year, but we're going to have 4 family resource specialists who are just answering phones, plus outreach people. Like, we've grown a lot in 2 or 3 years, but our numbers have grown too. So it just had to happen. But like I said, we started off with $100,000 to help plan.
Okay.
So
Great.
it grew over time. Yeah, I don't be afraid of the money, because if there are people already in the community doing this work, it can be a double job. So it's so dependent on your community, how to budget it and how it ends up forming.
Jen, I want to be considerate of everybody else, but I have like 6 or 7 questions. Do you want to go to someone else, or?
Let me jump to someone else, and then we'll make sure that you guys connect offline if we don't get back to you.
Thanks.
Thanks, Sharon.
Oh, yeah, and I'm going to put this slide back up too, just so everyone has it.
Yes, thank you. We have a question from New York State Department of Health, wondering if Help Me Grow on Long Island works with the MICHs, the Maternal and Infant Community Health Collaboratives.
Yes, we do. Actually, we have a good relationship with both county MICHs. I would have to say that our relationship with the MICH program in Suffolk is stronger, and I literally think it's because our first family resource specialist was from Suffolk. Like, you get the strangest things in this, like how people end up connecting and knowing each other. But yeah, we work on a regular basis with them, and they're great.
Thank you. A lot of our questions are you working in Herkimer? Are you working in Albany? So I think what I'm seeing is there's a lot of interest in starting up programs, and that's what I was hoping for. Whether we can scale up Help Me Grow across the state, or we can put it in pockets and connect those little pockets, I think we would be really happy. So contact information is there for both Liz and Lori, and Maggie and I can serve as a resource as well. We would love to work with folks on, how do we do this? But what I'm seeing is a lot of interest, which is fantastic. I want to take one, I think, last question, and I know that it was answered in the Q&A, but I'm not sure that everyone's following the Q&A. There was a couple of questions about translation. Can you guys tell us what you do in terms of offering services outside of English?
Liz, do you want to start? Because you do so much of this down on Long Island. Maybe she lost her sound. Let me say what I said in the in the chat, in the Q&A. I was asked about Chinese specifically, and then I jumped off, and I think other people have come on with some other languages. The website is able to change the language, so people can read the website in different languages. So there is that feature built into the website. And then the ASQ3 and the ASQSE have multiple language that is available in. So if you're in a community that is a Help Me Grow, you can work with that Help Me Grow to find the right instrument. We purchase, just kind of concept-wise, we make the ASQ3 and the ASQSE free on the websites. We as Help Me Grows pay for that. So the Brooks system that creates the ASQ and ASQSE, we have the online version, and for every screen we accept, we are charged for that screen. And so there is the ability to purchase other languages. Right now on the website, just the two dominant languages are English and Spanish. But if we needed to kind of customize the approach with other language, we would be able to do that locally. And then Liz, I think you might be back on.
Yeah, sorry, my phone just dropped me.
Yeah, so, but I was saying you do so much more language diverse work on Long Island. Did you want to speak to what you do? And then if you call the 211 lines, they're very familiar with how to have language line or whatever your specific 211 uses. And so we have the ability to kind of connect in the 211 infrastructure through multiple languages.
Yeah, so, I mean, sorry. Can you hear me now?
Yep.
Okay. So with the languages, we have 2 family resource specialists right now. Actually, we have 2 full-time and 2 part-time. I always forget the part-time. 3 of them are fluent in both English and Spanish, and 1 of them is fluent in English and Haitian Creole. Those take care of the vast majority of our families on Long Island. We have had single episodes where we needed someone to translate Bangladeshi, Urdu, Mandarin, Turkish, and that was like way out at the other end of the island. I didn't expect that. And for those, we use Language Line. And, you know, I'm sure you've all used Language Line a little bit in your own practice. It's not the best, but there's no way. So we monitor. That's one of the things where the data comes in. So we keep track of all this. And, you know, we're really sitting on the fence with the Haitian Creole. It's like 3%, but it is a very concentrated, isolated population. So we want to keep that for sure, right? Like, so you take what your population distribution is of your languages, and then you decide where to make your investment. Like I did see somewhere in the chat, I was reading some of the questions about like materials in Chinese. Like certainly if we were in Manhattan and the Lower East Side, we would have a family resource specialist who spoke Chinese or Mandarin or Cantonese and English, you know, again, depending on your neighborhood and depending on your cultural appropriateness. So we try to meet it, but as you all know, sometimes you need Language Line.
Jen, I
The
just want to
material-
add one more thing. Liz mentioned data a couple times, and that is a whole nother conversation about early childhood system data collection and where it's lacking. But Help Me Grow is really, for a community, phenomenal in the sense that we both use the STAR database system, which was created for Help Me Grow systems, and the ability to pull up data about the needs of families, the ages that are being served. It's a whole new world. Like, we spend lots of times at the Early Childhood Alliance talking about the lack of data. Help Me Grow is a way to start at the local level collecting really impactful, meaningful data about languages, barriers, connectivity. And so the amount of analysis you can do through Help Me Grow is extraordinary compared to a lot of the struggle we have in collecting data.
And I will back that up, Lori. Sorry for my sound.
We don't hear it, it's just you.
Okay, I have this terrible echo. So after COVID-19, right, March came, we thought we were going to have no calls because who was going to be worried about child development, right? And it's true. Child development is usually 90% of our calls, or like 80% of our calls. It went down to 0 for 3 months. No one called us about a developmental delay for 3 months. No pediatricians referred anybody, nothing. But our call volume increased by 300% because families were in need of basic needs. And because we track every phone call, every request, everything, we were able to say by July to a funder, we've had this incredible increase. These are the number of families that have called for clothing. These are the number of families that have called for diapers. They can't find formula. We called Bea Johnson, the Long Island rep. She was able to send to families that couldn't find Nutramigen. She basically got Nutramigen month supplies sent directly to the family's doors in March and April. So because we had the data, we were able, and the tracking system, we were able to then get, we got $50,000 to spend on basic needs in Long Island between July 1st and December 31st. And it's all going to diapers. And we bought a crib. We have done some other, small things for individual families that have needs, but for the most part, it's diaper distribution. And if each of those programs, because I know the home visiting programs are experiencing these shortages as well, if each of you were experiencing these families and no one was collecting the data, no one would have gotten any money. I mean, I hate to sound that coarse, but the fact of the matter is that because we had this data system, we were able to very clearly demonstrate a need rather than everyone saying, well, families don't have diapers. Well, what do you mean families don't have diapers? How many families are you talking about? How many diapers do you need? Right? And not able to answer those questions. So we were able to answer those questions and get funding specifically for that.
And we're having a similar experience around formula where we already have a diaper bank, but now we're having the conversation about a formula bank because our numbers, our calls were all about baby formula and needing a more systemic approach to how we support outside of WIC some purchasing of formula that parents were experiencing during COVID-19.
Thank you both for that. I think that one of the things that makes this model so strong is the data collection and analysis, and that's something we always struggle with. I feel like in New York State, and especially making the funding case and the policy change case. So that's really good information to have. I'm going to wrap this up, which I hate to do, but we want to be respectful of everyone's time. But I know that there are more questions, and so I hope that folks will reach out both to Liz and Lori and to me and Maggie. We can connect you. We want to continue to have this conversation. I will ask, as Maggie said earlier, later today she's going to send out a link to or an email to everyone with the presentation and with a link to a survey back to data collection. This is something that we need to do as one of our deliverables for the Federal Preschool Development Grant, which is funding these webinars. And so it will take you 5 minutes, but it's very important information for us to have. So I would just ask you quickly, before you go on to enjoy your weekend, fill out that survey later today. And then we will be in touch in the next week or two with our November webinar announcement. We're excited to continue this series, and we're always looking for ideas. So if anyone has any ideas, let us know. Liz and Lori, thank you so much for your time today and for talking about Help Me Grow. Again, we hope to continue to have this conversation because we really think it's a successful model that we should be paying more attention to.